Hi, my name's Irene Hibbert, and this is my presentation on nursing moral values. The picture I chose that reflects my values are the ones you see on is the one you see on the screen. I just thought that it really embodies a nurse's role for caring about a patient, and my moral values are non-maleficence, beneficence, accountability, and autonomy. So for non-maleficence, that's to do no harm and always what's right for the patient. And then beneficence is basically a fancy word for doing everything with kindness and empathy, which is exactly what I think this picture shows right here. The nurse looks like she's listening to her patient and even touching her to show how much she cares about her. And accountability, in my opinion, is the most important moral value for any nurse, including myself. Nurses have to give meds, do procedures, give bedside care, and all nurses are held accountable for themselves for all these tasks. And honesty goes right along with accountability as well. And if we make a mistake, the nurse has to speak up for what's best for the patient. With the patient's best interest in mind, autonomy is another principle to nursing. Nurses have to use clinical decision-making daily based on their skill and knowledge. With all these being said, the picture represented my morals because the nurse looks like she truly cares for the patient, and I have no doubt she would act on the patient's needs and provide care for best patient outcomes. I work at the Bronson Battle Creek Emergency Department, and I get to see a lot of ethical dilemmas faced by other nurses and myself. The biggest ethical dilemma I've faced was when a patient came in for a fall and had previously dislocated his shoulder the previous day. He came into the ER with a sling that wasn't even being used properly, and the dilemma was that he was developmentally delayed and not his own guardian. So we had to do CT scans and x-rays because he was a bad historian, and we found that he dislocated his shoulder again. If you're not familiar with the treatment for shoulder dislocations, it's normally a conscious sedation, which I've seen and done a few. The problem is that you need consent for this, because it's invasive and comes with quite a few risks. So I called his guardian and AFC home multiple times, and the AFC home did eventually answer. When he was at the ER the day before, when he dislocated it, they were able to get a hold of the guardian by phone and get verbal consent. I was unsuccessful doing that. The AFC home actually told me that the guardian was difficult to contact. Even the doctor tried calling, believe it or not. So after a few hours of debate and trying to put it in without sedation using fentanyl, the doctor finally decided to do the sedation without consent and claim it was a medical emergency to justify doing it without the consent. After watching the video, Healthcare Workers Facing COVID-19 Burnout, I didn't realize how much of a difference it made on nurses' lives. I personally did not work through COVID. I actually went to nursing school through COVID. So I've actually never heard of any suicides until this video. Not only that, I didn't realize how much stress nurses took on, as well as anxiety and depression. Although not really related to the video, I think a huge dilemma for healthcare workers was how they were required to get the COVID vaccine. Nurses and other peoples in healthcare lost their job over getting the vaccine or not getting it. Although it should be a person's right to vaccinate or not, a healthcare worker can put patients at risk if they don't get it. As mentioned before, one of the biggest moral values of nursing is doing what is best for the patient. So nurses had the dilemma of to vaccinate and work or quit nursing entirely. According to the National Library of Medicine, the overall pooled prevalence of COVID-19 vaccine refusal among 41,098 nurses. Worldwide was 20.7%, which is quite a large percentage of nurses. Just think about if you lost 20% of your faculty, that's quite a lot. Another dilemma I thought about was the visitor policy. Since there was a lot of sick people in the hospital, it feels wrong to not let a family member come back to see their loved one, either if they're dying or just to visit. We still see those dilemmas today, more so as an aftermath of how many nurses got lost because of the vaccination. And the visitor policy, I don't feel is as relevant in my experience. In the ER, we still let people come back, but it's still 2 people per patient. But if they are a COVID rule out, we actually don't let anyone come back until their COVID test results. But to support healthcare workers and how they continue to give the best quality care to their patients, healthcare organizations need to provide support for their physical and emotional health. Nurses are too busy taking care of others that most of the time they don't take care of themselves. Promoting self-care and support should be accessible in any workplace. To continue moral values in the workplace, continuing education can be provided as well to help people understand their weaknesses, because we all make mistakes. A safe work environment does not just include workplace violence or proper equipment, but having enough staff to keep patients safe. If there are more patients than a nurse can handle, this puts patients at risk. From all these readings is how important each individual's moral values are and how they are affected. From the article written by Cohen, it discusses how each person has different beliefs and values. Because of this, ethical dilemmas are born. Cohen writes about how a nurse should be able to identify dilemmas and how ethics and morals can help us find solutions. In our book, Doherty has good examples for dilemmas and how to go about them as well. He also discusses how moral distress occurs and how an outcome is determined. And then this is my reference slide. Thank you for watching.